Ontario, of course, as you know, already beginning its vaccination. But as much as there is hope on the horizon because of that, a reminder of the reality facing hospitals right now. They are racing this morning to be ready for a surge in COVID-19 patients. CBC News has obtained a memo from Ontario Health ordering hospitals to prepare to activate their emergency plans, as in ramp up to be ready in 48 hours. Cases in the province reached a new record high yesterday, nearly 2,300 cases, the first time Ontario has cracked the 2,000 mark, although we should tell you that officials say the high number is due in part to a shift in how regional numbers are reported. Hospitalizations, though, they are at levels that have not been seen since May. More than 920 patients in hospital, nearly 250 in intensive care, and the majority of those on ventilators. Greg Ross this morning with the details on how the already stretched healthcare system is bracing for even more.
This pandemic is clearly rapidly accelerating.
And as a result, the president and CEO of the Ontario Hospital Association says the situation in hospitals is dire.
I've worked at the OHA in different roles for almost 16 years, and I've never seen anything like this, and I've never been as concerned as I am now.
CBC has obtained a memo from Ontario Health that was sent to all hospitals in the province. It says, we have entered a more critical phase of the pandemic where we are seeing widespread community transmission. Our ability to care for patients, COVID and non-COVID alike, is being challenged. As a result, hospitals have been asked to activate surge capacity planning within the next 48 hours.
You're looking really at the systematic shutdown of elective activity. Elective is a kind of general term. I don't really like it because it almost suggests that the care that's needed is optional. But it can be cancer care, it can be cardiac care, it can even be organ transplantation.
There are currently more than 900 COVID-19 related hospitalizations across the province. Ontario Health says hospitals need to make an additional 10 to 15% of their beds available for COVID patients.
The 900 now feels a lot worse than the 900 or even the 1,000 that we had in the spring.
This emergency room doctor says the latest surge is taking a physical and mental toll on frontline healthcare workers who are once again being pushed to the brink.
It's just fatiguing, and I've said that before. It's just after 9 months of this, everybody's getting tired.
And yet the latest projections are suggesting the situation is only going to get worse. With the holiday season upon us, health officials are concerned about another big spike if people ignore provincial guidelines to stay home, instead gathering with family and friends for celebrations.
Wouldn't it be a tragedy for the worst part of this pandemic to happen just as the vaccines arrived on Canadian soil? Because that's what we're looking at in the month of January. We're looking at, in communities right across this province, unnecessary death, lifelong damage to the health of people. And these aren't strangers. They're people, they're your friends, they're your neighbors. They might be your mom or your dad, it might be your grandma or your grandpa.